I'd now like to introduce Sophie Cushworth, the Chief Executive Officer from Women's with Disability Australia. Sophie will be sharing insights on effective co-design for women, girls and gender diverse people with disability, address barriers to and opportunities for effective design. Over to you, Sophie.
Thank you, Suzanne. We would like to build on what People with Disability Australia has presented by focusing on what co-design must look like for women, girls and gender diverse people with disability. As Bobby has put so well, co-design at its core is about partnership and power, in who defines the problem, who makes decisions and who benefits from the outcome. And as Bobby mentioned, this is not just good practice, but a requirement under the CRPD. Article 6 of the CRPD further recognises that women and girls with disability experience multiple and intersecting forms of discrimination, and it requires targeted action to address this and to ensure our full development, advancement and empowerment. The CRPD committee has reinforced this in General Comment number 3, calling on states to ensure that women with disabilities, through our representative organisations, are actively involved in the design, implementation and monitoring of all programs that affect our lives. We are specifically named, not because women with disability are inherently vulnerable, but because systems are often designed in ways that exclude us and cause harm. Every day our lives are shaped by systems that do not work together. Disability services may not account for gender-based violence. Violence services may not account for disability. Health systems may miss disability experiences which are more common for women and gender diverse people. We are often asked to explain our lives in separate parts when we experience them as a whole. So co-design has to do more than invite us into the room or to the table to give feedback. It has to change how a problem is understood, how decisions are made, and what gets built. Co-design has become a common word, but for women, girls and gender diverse people with disability, the risk is that this word is used without changing who holds the power. We are asked to give feedback on systems that have already defined the problem without us. But at a basic level, the test is simple. Did people shape the decision or just respond to it? Could they change the scope, method, budget, timeline or final product? Was there a clear report back on what changed because people were involved? We also need to be clear about what makes co-design possible. It takes time, planning and resources. Accessibility and inclusion must be funded and built into timeframes from the start. So today we will cover 3 areas: effective co-design for women, girls and gender diverse people with disability, barriers and opportunities, and applied examples from our work. The first practical step in effective co-design is to start with power, safety and access. Effective co-design starts early, because if the problem is framed too narrowly, the solution will also be too narrow. People need to be involved when you define the problem, choose the method, decide what evidence counts, and evaluate success. For our community, this matters because we are often missed at the point where systems decide what the problem is. Health systems may miss chronic illness, pain, fatigue, autism, ADHD, fluctuating disability presentations, because diagnostic tools and service models were built around men and boys. Violence systems may miss disability. Disability systems may miss gendered violence, parenting, reproductive health, sexuality, poverty, and unpaid care. Justice systems may ask people to tell their stories in ways that are unsafe, inaccessible, or impossible. So the first practical step is this: design from the lives of the people most excluded, rather than from who you might think is the average user. Ask who currently gets missed. Are First Nations women with disability in the room? Culturally and linguistically diverse women with disability? Women with intellectual disability? Girls and young people? Are people in rural, remote and institutional settings in the room? Are gender diverse people with disability in the room and named in the process rather than folded into broad language? And then ask, what do they need to participate safely and meaningfully? Do they need easy read, interpreters, support people, childcare, one-to-one sessions or different formats? And design for access from the start, rather than waiting for people to prove that they need it. Effective co-design also values lived experience, and that means paying people for preparation, participation, review, and follow-up. It means paying for access costs, and it means being clear about what decisions people can actually influence. It also means having multiple ways to participate. Some people will speak in groups, some will write, draw, or record audio, some will attend once, and others will engage over time or through organisations that they're already connected with and trust. Good co-design gives people more than one way in. For women and gender diverse people with disability, safety also needs practical design. This can include trauma-informed facilitation, access to counselling support, and referral pathways, especially if disclosures are made. The role of co-design is to create safer systems, better policy, and better services. It should not extract stories and leave people carrying harm. Support for decision-making and participation is also critical. Parents, carers, workers can support access, but they should not replace the voice of the person with disability. The question is, what support enables this person to express their own view? So the first takeaway is this: start early. Put women, girls, and gender diverse people with disability in decision-making roles from the beginning. Fund access, pay people, build safety, offer different ways to participate, and then report what changed. We also need to understand the barriers to effective co-design. The first barrier is unclear scope. Women and gender diverse people with disability are often invited to share their experiences without being told whether that experience can change the decision. Before you invite people in, be clear about what you are asking for them. Are they advising, testing, co-producing, making decisions? People need to know the level of influence they will have before they participate. The second barrier is late involvement. And we see this play out when people are asked to engage on projects after key decisions are already made, or when significant policy changes are developed quickly, or in response to external pressures like budgets. If engagement starts after key decisions are made, people are not shaping the outcome, and this leads to systems that miss the people they are meant to support. This is especially harmful in areas like disability support, violence, health, parenting, or sexuality, because the original frame may already have missed gendered disability realities. At the intersection of gender and disability, this is something we see all too often, that policy and programs designed to improve the lives of women don't think about disability, and policy and programs designed to improve the lives of people with disability don't think about gender. The third barrier is consultation fatigue. Many people are repeatedly asked to share their stories without feedback, outcomes, or real change. People need to know what they've contributed to and what has changed as a result. The fourth barrier is inaccessible process. Long documents, short timeframes for engagement, technical language, and unsafe or impractical conditions all exclude people, often those most affected by the issue, and undermine commitments to co-design. The fifth barrier is administrative burden. Many systems assume that people have stable housing, stable income, reliable internet, high literacy, spare time, and confidence dealing with institutions. Many women and gender diverse people with disability are also managing care work, domestic labour, trauma, poverty, health appointments, and fluctuating energy. Complex systems, unpaid participation, and inflexible processes can create high barriers to entry and exclude our community. The sixth barrier is power imbalance. For women and gender diverse people with disability, this power imbalance can also include fear of being judged, disbelieved, pathologized, or treated as unsafe to parent or make decisions. Professionals often control the agenda, language, evidence, and final decision of projects. Funders may control timelines and deliverables. Researchers often control methods and publication, and governments may control policy and budget options. But effective co-design requires actively shifting these dynamics. This can include shared chairing, paid lived experience roles, steering committees, co-authorship, partnership, community review, and evaluation led by co-designers. So the second takeaway is that co-design needs time. It needs access, payment, trust, clear influence, and accountability. I now want to move from principles to practice and share 2 examples from our work. Importantly, these projects were funded by the Australian government to be led by our organisation, and this is significant. The CRPD committee has identified that a key barrier to implementation of the convention and the right to participation is often the underfunding of organisations of persons with disabilities. These projects recognise the critical role of partnership and resourcing that partnership, and the leadership of organisations of persons with disabilities. The first example is Our Site. Our Site is a website developed by and for women and girls with disability. It was co-designed with more than 100 women and girls with disability across Australia. Our Site is an example of intersectional practice because it starts from identifying a structural failure. Gender equality resources often assume women are non-disabled. Disability resources often avoid topics like sexuality, relationships, reproductive rights, and violence. Health, education, and violence prevention systems often treat disabled women and girls as passive recipients of care rather than people with rights, choices, boundaries, and expertise. Our Site responded to that failure. It created a space where women and girls with disability could access information about their bodies, their rights, relationships, and safety from a starting point that recognised their autonomy. Intersectional co-design is not just about adding more groups to something that already exists. It's about finding where existing systems are failing people and building from that point. The second example is Neve. Neve began as a project to expand Our Site, with a focus on violence against women, girls, and gender diverse people with disability. But early co-design workshops showed the community had a preference for a whole new website. So the project changed. This is a really practical example of power sharing, where the community had the power to change the scope and final product. Neve engaged more than 200 women and gender diverse people with disability, family members, supporters, and sector professionals. A paid steering committee of women and gender diverse people with disability guided the project from start to finish. The project used multiple entry points: in-person and online workshops, surveys, steering committee meetings, expert co-production panels who wrote and designed the website content, quality review, user testing, feedback loops, and story submissions. This mattered because people participated in different ways. Neve made accessibility a design priority. It became Australia's first Easy Read First website. Users arrive in Easy Read First with the option to move to plain English. And this was a design choice. People who face the most barriers should not have to do the most work to access information. Neve also includes text-to-speech, larger text options, and a calm space for users who need a break from sensitive content. And these features came from listening to participants and designing around access and safety. Neve shows trauma-informed co-design in practice. The website covers topics like violence, abuse, sex, relationships, consent, money, online safety, confidence, and well-being. WIDA made counselling available at workshops and began workshops with a safety and well-being process. Participants shaped the language used to discuss violence and abuse. Their feedback also led WIDA to broaden the website beyond crisis information to include pleasure, confidence building, and self-love. Participants told us that the website needed to feel welcoming and safe, so the home pages do not mention violence or abuse at all. Our community didn't want the name of the website to mention violence. They wanted a resource that would keep them safe and make them feel safe at the same time. And this shaped the tone of the content and the creation of the character named Neve, which means bright. The website is written as though it is the character Neve talking and sharing her advice. This is intersectional practice in action. Neve did not ask women and gender diverse people with disability to separate their lives into different categories. It recognised that violence, disability, gender, sexuality, and confidence often sit together. So the design had to respond to those realities together. And that is why Neve includes information about abuse, but also consent, pleasure, confidence, online safety, and self-love. The co-design process changed not only what we said, but how we understood the problem and what we understood the problem to be. The practical takeaway is that intersectional co-design must change the frame that we're working with. We need to avoid asking people to split their lives into categories. Ask how the system needs to respond to their whole experience. So I'd like to finish with one final point. Co-design should change something that people can see, use, or feel. And that change is visible in Our Site and Neve. Our Site shows what becomes possible when women and girls with disability build a resource about their own bodies, relationships, rights, and safety. Neve shows what becomes possible when co-design has power to change the project itself. And both examples show what can be achieved when states provide funding, resources, and time for genuine co-design. And that is the standard we must take into the next phase of CRPD implementation. Co-design that changes decisions, shifts power, and leaves people with disability with something safer, more accessible, and more useful than what came before. Thank you.
Thank you, Sophie. Some really powerful principles, but also practice shared there. Thank you.